Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. Hope you're all well. Hope you had a great weekend. Hope you're settled in and going to spend the next hour together learning about better health, health care, how to interact with the doctor, how to get better cancer treatment that may be unknown to you at this moment. So we are live, and we're at the WOR studio, and you can call us if you want. Give us a test to see if we're live at 1-800-321-0710. The 710 is for the radio station signal. Again, the radio studio is 1-800-321-0710. And a special thank you to Susan and Andy for a great weekend, a great day together, and Kwang Suk, great guest. Hope your weekend was fantastic. I was happy to be with you. I want to talk about a woman with breast cancer, and it's very instructive because many people are told, many people who have metastatic stage 4 cancer, the cancer's in the blood, so you have to have chemo because only chemo can go where the cancer is. Well, that's true and not true. It's true, chemo goes from head to toe. They stick it in a vein, and it goes from your head to your toe and your ears and your nose and your toes, and that's why you get neuropathy. But the unspoken words about chemotherapy going everywhere is that it doesn't necessarily work everywhere. Yeah, sure, the toxicity may be everywhere. It may hurt your kidneys or your ears or your fingers or your bone marrow or make you lose your hair. And there are some great chemotherapies that cure people, like Lance Armstrong had testicular cancer with lung metastasis and brain metastasis. I didn't take care of him, but you can read about it in the book. And I certainly took care of many men with testicular cancer, and this disease, which was once fatal, is now mostly curable. But for other patients, like this woman who has metastatic breast cancer, chemotherapy often doesn't produce those same kind of results. This woman came to me. She's about a 60-year-old Russian woman, lives by herself. She has metastatic breast cancer. She had surgery and radiation and chemo, and it didn't work, and she really got fed up with it because of the toxicity, and it didn't work. And a few years ago, she started coming to us for focused beam treatment. So if a cancer's in, let's say, the lung, we hit the cancer in the lung. If it's in the bone, we hit it in the bone. And then usually she goes into remission, and we follow her every few months, get blood tests, physical exam, and other tests to make sure she's in remission. If a new spot appears, we hit it. Usually it's 5 treatments. Each treatment's 15 minutes. So she's had surgery, she's had chemo, she's had radiation in the past, and her preference is radiosurgery. So right now she's coming back to us for a spot in the right lung. It's a new spot. We treated about 5 other spots over the last couple of years. They're all in remission. So the big plus is we have a very high success rate up there with Ted Williams. Ted Williams batted 400. We're batting about 900. And for her, it's all non-invasive, well-tolerated treatment. So, of course, we wish her well. And it may be instructive for you all that just because you have metastatic stage 4 cancer, if you do, hope you don't, but if you do, there are other options besides more and more and more chemotherapy. And also, chemo usually gets less effective as it's given over time. We had other men who came, and I'm trying to give lots of examples tonight since we have so many and was such a busy week. We had a 54-year-old man who was maintenance worker, had 2 children. His PSA was 23. He saw another physician for an enlarged prostate. PSA was 23 2 years ago. And he's had burning urination, and he's never had any workup. It's unbelievable. So he came to us the same day. We arranged everything to find out the cause of this high PSA, the cause of his prostate symptoms. It's very likely, it's not guaranteed, but it's very likely that he has prostate cancer with a high PSA of 23. If you look at our success rate compared to surgery, for example, and in our book you can look at the high PSA group, you will see that our success rate is much better than the other guys. For example, if you go to the chief of urology at a big cancer hospital nearby and they remove the whole prostate, this is a group PSA 20 to 50, if they remove the prostate, only 44% of those men are cancer-free 5 years later. So can you believe that? I know people often have trouble thinking that if you remove the prostate, you should be home free. Well, in this group, in fact, 60% of the men have recurrence of the prostate cancer after radical prostatectomy when the chief of urology at this big cancer hospital removes the prostate. Of course, most men are left incontinent and impotent. You can look at that data, which is also in our booklet. Our results, 66% better. 66% better without radical surgery, without losing the blood, without that cutting. 66% more men are cancer-free, even in that high-risk group, PSA 20 to 50, than who had surgery. So for this man, he needs to get a biopsy. That would be the best thing to do. And then speak to us about treatment options. We've arranged everything for him, even though we've been seen by other doctors for 2 years and nothing was done. Don't ask me why. I don't know why. When patients come to us, we try to take care of you promptly with great doctors and great care, concerned about your health, your financial health, your family health, and all the other aspects of life. And here's another man with prostate cancer. This man has prostate cancer. He owns a auto recycling business. He's about 65. He has 3 kids. Came in this week. 5 of 12 cores of his biopsy were positive, including 3 of the cores positive for Gleason 7. Gleason, again, was that pathologist that tried to tell us how aggressive a cancer would be. Gleason more than 6, so Gleason 7, 8, 9, 10 are considered higher risk. This man has been looking around different options. He was interested in CyberKnife treatment. Well, in fact, there's almost no data out at 5 years. I told him, look, he's a pretty young man. He's most likely going to live another 20 years. Our data in his category shows a 90% cancer-free success. So would you want to go with data that shows 90% cancer-free success with us versus 60% with standard radiation or surgery, or unknown with another treatment? Yeah, you can get the latest gadget, but that doesn't mean there's any data. And then people find, whoops, I chose wrong. Well, if you choose wrong, that may mean bad news for your health, bad news for your life, and a greater likelihood of cancer recurrence. So I showed them all the data, and I'll be happy to show you all the data as well. We have a booklet which we'll send at no charge to you. Just call our office during work week, Monday through Friday, 9 to 5, and we'll put that package in the mail to you so you can see exactly what the risks are, why we do what we do, and how we stack up to major cancer hospitals across the nation. When you compare our published data to their published data, it's all in our book in a form that is easy to understand, and it's really best that we sit down and talk about it together. Another woman who came in today, interesting woman, not today, Friday. She's an 80-year-old woman with a parotid cancer. She had surgery and standard chemo and radiation elsewhere at a big hospital in town, and that was 5 years ago. She was left with facial paralysis when they removed the parotid gland. The parotid gland is right next to the ear and the facial nerve. The facial nerve moves the face, allows you to close your mouth when you have a sip of tea or soup so your soup doesn't fall to your mouth. So when you smile, one side doesn't go up, one side doesn't go down. In her case, unfortunately, it does. She has trouble eating, trouble smiling, trouble functioning. Her eyelid doesn't close. Her whole face is paralyzed. And even though she paid that heavy price for the surgery, the standard chemo radiation, her cancer came back. And where did it come back? Right where it was. She learned about us. She came to us. We treated her with radiosurgery, 5 shots to the recurrent mass. It was done with no side effects. She's in remission. She had a PET scan this week. Negative. All cancer is gone, undetectable. Nada, nothing is there. She is happy. Her husband's happy. And, of course, I am very happy for her that our treatment lived up to high expectations, and thank God she is in remission tonight from a recurrent parotid cancer. We had a man who came in this week, also a German-born man. He moved to the United States in 1959. He is single. He has blood in his sperms, blood in the ejaculate. He was very worried about himself, so he came in to get checked out. Worked him up, did the tests, and actually found an elevated PSA. He's found sexually active. That's another possible cause of blood in the sperm. So what are the causes of blood in the sperm? Well, it's called hematospermia. It's a medical term. It can be caused by many sources. One is infection or inflammation. Probably infection or inflammation is the number one cause. Now, how does the sperm travel? Well, there's the prostate. The prostate produces part of the fluid in the ejaculate. There's the urethra that carries the urine and the semen through the penis out to the world. There's the epididymitis and vas deferens, which are little structures where the sperm mature before ejaculation, and seminal vesicles, which add more fluid to the ejaculate. So that's the path of sperm in the body, and obviously any infection or tumor of those sites or trauma can cause blood. Of 900 patients with blood in the semen or sperm, actually only 3.5% had a cancer, and most of those cancers were in the prostate. Now, this gentleman had an elevated PSA, so he's getting worked up. I sent him immediately for checking his prostate with his elevated PSA and blood in the sperm. He may well have prostate cancer. I'll report back to you. I thought you might be interested to know what causes blood in the ejaculate. Now you know. We're going to hear from a few new voices about radiosurgery now. My name is Dr. Lederman, by the way, and we are at a private cancer treatment center in Manhattan called Radiosurgery New York. We are private, meaning you are our boss. It's not run by the surgeons or the chemo people or pharmacy industry. No, you are our boss, and you get to see a board-certified, triple board-certified doctor, not a student, not a resident. You get to speak to a human being, not a machine. We're located centrally in Manhattan, 38th and Broadway, so we're close to Penn Station, Grand Central, most of the trains, buses, subways, PATH trains, and Port Authority. So we're very convenient. We have a modern, new, spacious Cancer Treatment Center. We have our own operating rooms, hyperthermia rooms, linear accelerator, CAT scans, physics,